Greetings, I'm Susan Bratton. Welcome to the GAINSWave webinar called Sex and the Prostate. I am here and joined by Dr. Judson Brandeis, board certified urologist and director of clinical excellence for GAINSWave. And we are so happy to be here today with you. I can't wait to learn about the prostate. It's kind of my next frontier of masculine urogenital knowledge. So I'm here to soak it up like the sponge that a prostate is. So let's see. The first thing we're going to talk about is prostate anatomy. Here's the plan. Over the next hour and a half, we're going to be talking about all kinds of specific things to teach you about the prostate. And then we're also going to be answering people's questions. I don't know if you can see how many pieces of paper I have here, but I have pages of questions that so many of you sent in ahead of time. And Dr. Brandeis is just going to knock them out one by one, which is great. And then if you have a question and you didn't send it in, don't worry. You can enter it into the chat. If you're on a computer, the best way to type into the chat is from a computer. If you're on a phone, you're going to have to navigate around to find the chat. It's there. And then you'll have to find your way back to the video. On the phone, you kind of go back and forth between the two of them. It's a little bit more difficult, but you'll be able to do it. So let's see. Dr. Brandeis, I'm going to call him Judd. His name is Judson Brandeis. Judd and I are going to talk about prostate anatomy and function. So he's got all kinds of demonstrations. We've got so many things you can't see here on the table below us. He brought so many interesting things to show you. It's kind of like show and tell for the prostate. We're going to talk about prostate problems, overgrowths, infections, and cancers, as well as prostate surgeries, the types and how they affect sexual function, the TURP, the Resume, the Urolift, and the radical prostatectomy. Did I do it? If you register for the webinar, I was like, prostatectomy.
Amazing.
I see.
You've been practicing that all week.
Well, now I can also say tunica albuginea. Almost. It's still hard to say. Retrograde and dry ejaculation, how to recover your erectile function after prostate surgery. This is where GAINSWave comes in, and we're going to tell you how that works. Psychological counseling, supplements versus PDE5 inhibitors, and we'll tell you about GAINSWave, vacuum erection devices, aka penis pumps, and PRP or the P shot. So we've got that plus a bunch of questions and some show and tell, and I think we should get started with prostate anatomy and function.
Absolutely.
Tell us how it works.
So the first question so many patients ask me is, what is the prostate and what does it actually do? So the prostate is a gland. Glands in your body make fluid. So the salivary glands make saliva. The prostate gland makes semen.
Yay!
So it doesn't make sperm.
It's good for you.
Yeah, there's a lot of protein in there.
It has a lot of good things in it.
A lot of fructose in there. So this is the bladder. And when you urinate through the prostate and then out through the penis. And so a lot of patients say, you know that God was an engineer because he put a waistline through a recreational area.
That's so funny.
So this prostate gland produces semen. It doesn't produce sperm. So the sperm are actually produced in the testicle, and they come up through the vas deferens, and they come out through the ejaculatory duct right here. And so when a man reaches climax, what happens is the prostate squeezes and the seminal vesicle squeezes, and it pushes the fluid and mixes it with the sperm in the prostatic urethra. What happens then is that the bladder neck closes, and because the bladder neck closes, you have antegrade ejaculation. So the ejaculation comes out through the penis.
Instead of retrograde,
Exactly.
which is where it dumps back into the bladder.
Exactly.
Okay.
So during certain prostate operations, what happens is you open up the bladder neck. And when you open up the bladder neck and you ejaculate, the semen basically takes the path of least resistance, which is to go up into the bladder.
Is that a sphincter?
That there are two sphincters. So it's the internal sphincter and the external sphincter. So the internal sphincter is the sphincter controlled by your brain that you have nothing to do with. And the external sphincter is the one that you can control. So, for example, when you're doing Kegel exercises or a man does Kegel exercises, The pelvis is shaped like a bowl. And so when you contract a muscle, you make it shorter. And so that bowl pulls up. And so when a man does a Kegel exercise, he'll feel his buttock muscle tighten up, and you'll actually see the penis pull up. And so there are a lot of men that complain of post-void dribbling, meaning when they finish urinating, they drip a little bit more afterwards. If you start doing Kegel exercises, what you'll do is you'll strengthen that pelvic floor, you'll strengthen the external sphincter, and you'll be able to control urination a lot better. In addition, if you do Kegel exercises, you'll have a lot more forceful ejaculation. So if you want a stronger ejaculation, you can do Kegel exercises.
One of the things I know we want to talk about is ejaculatory volume, semen volume,
Right.
because a lot of guys complain that they're getting diminished volume and they're getting diminished sensitivity. So when we get into the GAINSWave, we'll talk about diminished sensitivity.
Absolutely.
But is there anything you want to say about ejaculatory volume now or later?
You know, I don't think there's actually ever been a really great study on ejaculatory volume. And there's not really a direct correlation between prostate volume and ejaculatory volume, because as men get older, what happens is the prostate becomes more calcified. In fact, during certain operations, when we begin to scrape away and open up the prostate, you'll actually see little stones on the inside of the prostate. And so even though the prostate's larger, the tubes that transmit the fluid out into the prostatic urethra get clogged. And so
the tubes that, say that again.
Right. So if you look at the prostate, all these little tubes basically, oh, there we go.
There, it looks like a little apple. This is my snack. Can you see it? See those little tubes? Okay, so those little tubes.
Right. So the semen basically comes out in two places. So the seminal vesicle live behind the prostate.
Okay.
And when semen comes out, it comes through these little ductules.
Oh, wow.
Okay. And then in addition, the prostate makes semen, and these little tubes will dump that semen out into the prostatic urethra.
It's fascinatingly like the urethral sponge or the female G-spot with the Skene's glands that recruit the blood plasma down into the urethra for ejaculation. It's the same function, just different way. So Jim's asking, what can you do to reverse retrograde ejaculation?
You know, unfortunately, once you have retrograde ejaculation, you basically have to wait until the bladder neck gets tightened up. And so there's really not a whole lot you can do. If it really became a huge issue, what you could do is basically go in and put a bulking agent right at the bladder neck.
You mean like putting what, like PRP or hyaluronic acid or something like that?
So you know how people get collagen for their lips? There are substances like that, but they're more permanent.
Long-lasting, like Sculptra or something like that.
Or
so like
there's something called macroplastique. And there's something called Durasphere. But to be honest, I've never actually bulked that particular area because that would make it more difficult for you to urinate. So that's the issue, is as the prostate gets bigger, it becomes more difficult to urinate. So at a certain point, urination becomes more important than ejaculation, believe it or not.
Right.
And
tough call.
It actually can be get to the point where it's really pathologic and it backs urine up into the kidneys. You can cause kidney damage. You can get bladder stones. You can get infections in the bladder. And so in those situations, what you really want to do is remove the prostate tissue.
You mean not all the prostate, not the entire gland, but just some of the tissue?
Exactly. Well, maybe this is a good time to get into this.
Okay, good.
So here's the prostate. Okay. And as the prostate continues to grow, this is what's called a Foley catheter.
Okay.
Right. So if someone is unable to urinate, what you actually have to do is put the Foley catheter up past the prostate, up into the bladder, in order to drain the urine. But as this prostate gets bigger and bigger, say it begins to constrict the tube, the urethra tube. So what can you do? Well, there's one thing you can do called the TURP. It's the transurethral resection of the prostate. So you go up through the urethra, that's the transurethral. Resection is removal of the prostate. And so there are a couple different ways you can do it. The traditional way is to go up with what's called a resectoscope and scrape out the inside part of the prostate. The advantage of that, of a TURP for those men out there who are having difficulty urinating, who get up 3 or 4 times at night, maybe we should kind of back up a little bit and talk about the symptoms of an enlarged prostate.
Yeah, great.
So there are irritative symptoms and there are obstructive symptoms. So the irritative symptoms are frequency, going to the bathroom maybe once an hour or twice an hour. Urgency, meaning when you have to go right away. I mean, you'll barge the door open in order to get there. Nighttime urination. Men get up 2, 3, 4, 5, 6 times at night. Burning on urination. Urinary tract infections or blood in the urine. Blood in the urine is a very worrisome symptom. If you have severe frequency, urgency, nighttime urination, burning on urination, or urinary tract infection, especially if you're a man, you should go see a urologist.
Yeah.
Then there are the obstructive urinary symptoms, meaning slow stream. Can you clear your toes when you urinate, right? If you're at a urinal and you're peeing on your toes, there's a big problem.
Okay.
Hesitancy. When you go to the bathroom at the ball game, are 6 people coming in and out by the time you finish?
It takes you a while.
That's a big problem. Intermittency, meaning do you send a little spurt out and then stop and spurt and stop and spurt? That's a big problem. Okay. And then residual urine. So when you finish urinating, do you feel like your bladder's still full? And so those are the obstructive symptoms. And if you have irritative symptoms or obstructive symptoms, it's important to go see a urologist. There are a number of things that we can actually do as urologists. First of all, you can be put on a medication called finasteride or Proscar or Avodart, and that shrinks the prostate.
Oh.
Another thing you can do is be put on an alpha blocker like Flomax or Rapiflow, and those relax the smooth muscle and open up the channel. Or you can take a medication like Cialis, which has a dual function. It improves erectile function and it relaxes the prostate, opening up the prostate. But if all of those fail,
that's because of the smooth muscle cells relaxing. Oh, that's very interesting.
Wow,
I'm picking stuff
you
up.
are
doing
smarter than the average
bear. All right.
But if you get into a situation where the prostate basically shuts down and blocks the tube, what you're going to need is this Foley catheter temporarily.
You do not want that.
You don't want that. Basically, what happens is the Foley catheter gets put inside the poor penis.
Yeah, that's a sad thing.
It's a really sad thing.
And then what does he have to do? Wear it to be able to go to the bathroom?
It's like to a bag.
Oh.
Yeah.
Yeah. So do not delay if you're having these
Some people
problems.
wear their heart on their sleeve.
Yes.
Some people wear their bladder on their leg.
We don't want you to do
Yeah,
that.
no, don't wear your bladder on your leg.
All right. So far we've talked a little bit.
We're covering a lot of territory.
Go back to the prostate again for me. Because I want to understand more about just overall the different types of things that happen to the prostate. So go back through those again.
Yeah. Okay.
What are we looking for and what can be done just like boom, boom, boom at a high level?
Absolutely.
Just a recap of what you've said. Because
the
there's a lot
common,
to take in.
so
there's a lot there.
Absolutely. The most common thing is enlargement of the prostate.
Okay.
So 50% of men in their 50s have some degree of prostate enlargement. 60% of men in their 60s, 70% of men in their 70s, 80% of men in their 80s will have difficulty urinating. And that's because this prostate enlarges. And when it enlarges, it becomes much more difficult for you to empty your bladder. And so you get those obstructive and irritative voiding symptoms.
Do you have to take medication or is there something you can do to preempt this or something that you can do so that you don't have those problems?
Exactly. So medication usually is the first step, but there are some patients who can't tolerate medication. Some people who don't want medication. There are some herbal supplements. Unfortunately, none of the herbal supplements have actually sort of passed the test of a double-blind placebo-controlled study. So there's, super beta prostate and saw palmetto and zinc and selenium and any of those things. There never have actually been a study that shows that those truly work. In saw palmetto, there are a couple of studies, but when they do what's called a meta-analysis, meaning they take all the studies, they bunch them together, what they find is that it works in 30% of patients. The only problem is a sugar pill will work in 30% of patients.
Placebo effect.
So medication usually is a first step. And then the second step would be to either clear out this prostate tissue to open that channel. And so the TURP was always the gold standard, and resecting or removing those prostate chips Then about 10 years ago, they developed the green light laser.
Okay.
And so instead of actually resecting the prostate, which was a pretty bloody operation, you could actually use a laser. And that laser would vaporize or open up a channel inside the prostate. But now recently, they've been developed a number of new technologies. And show and tell,
Yeah.
I brought some of them.
Good. He's got so many goodies down here.
Oh,
Make sure
yeah.
you see.
Okay. Look at the... Okay, so one of them is called Urolift.
Okay.
All right. So I'm sure a number of folks in your audience have had a Urolift procedure before. And with the Urolift, what you do is you put this through the urethra and you go up to the prostate and you put, it's almost look like a staple, and you push the prostate tissue back with these permanent staples, and it opens up the urinary channel. Now, the advantage of this is there's hardly any bleeding. It maintains antegrade ejaculation because you're not forcefully opening up the bladder neck.
Yeah.
And you're leaving most of the prostate tissue.
It's almost like a prostate lift.
Exactly.
It's like a tummy tuck or a facelift or something for the internal tissue of the prostate to get it off
almost
of the
like
urethra.
those threads that they use.
Yeah, thread lift.
Exactly.
It's like a thread lift.
It's
fascinating.
Women get thread lifts of the face.
Yeah.
Men get thread lifts of the prostate.
Okay, that's the Urolift. That's very interesting.
Yeah, there you go.
All right, good. So that's one.
Okay, that's
what
one.
else do you have?
This is called the Resume device.
Okay, REZUM.
REZUM. Okay, so some people decide that they don't want to have anything implanted into the prostate,
right?
Even if it's a tiny little staple. Okay, what the Resume does is it uses water vapor. And so what you do is you go up through the prostate, and you might be able to see this tiny little needle right here. This tiny little needle buries into the prostate, and then it shoots out steam for 8 seconds. So this uses radio frequency to superheat water to make it steam. And then that steam has about a 1 or 2 centimeter depth of penetration. And if you do this here and here and there and there and there and there and there and there, what you can do over time is to have the prostate sort of melt away and open up. And so you may be able to urinate a little bit better.
You're creating a you're creating a series of voids.
Exactly. And the nice thing about the Resume is it actually can be done in the office.
There we go.
There you go. Hey,
okay.
We're back.
I think you should do the water ablation again.
Aquablation. Yes, this is called aqua ablation, which is a robotic technology. So that actually what you do is you pre-program the template within the prostate that you want to use, and then you use this aquablation probe. It goes up through the prostate, and it uses 800 psi or something super high in terms of pressure, and it removes the entire inside of the prostate. Wow. So this will give you what's called a dry ejaculation.
Yeah, I was going to say, you're not going to make any semen anymore.
So
with any of these, do you basically cease making semen?
You know, the more prostate tissue that you remove or heat or freeze or resect, the less semen that you'll actually create.
Of course.
So if you're 55 and you have a big prostate and you're considering having children, none of these procedures really are indicated.
Yeah. Yeah, because you won't be able to. And it doesn't affect the sperm, but you just don't get any semen, so you can't ejaculate enough of the blended mix anymore? Or how does that work?
Exactly. So there's no semen for the sperm to swim in. So if you actually put a needle into the testicle or the epididymis, you can actually suck sperm out. Yeah. And then do in vitro fertilization.
That makes sense. Oh, yes, of course. There's always a way.
Yeah.
So
where there's a will, there's a way.
What about the radical prostatectomy? That's the one where you just go in and surgically remove the whole
by the way,
thing?
you're so smooth.
I'm getting it.
Okay, so with prostate cancer, prostate cancer is the second most common cancer in men.
What's the first?
Either colorectal or lung cancer. In terms of, it's the most common, but it's the second or third most common cause of cancer-related death in men.
Oh, wow.
Yeah.
Yeah.
Skin cancer, of course, is the most common, but it tends not to be very deadly.
Okay.
And so the question is, all right, if you have prostate cancer, in general, prostate cancer is a slow-growing cancer. So even though 15% of men have prostate cancer at some point in their life, only 3% will actually die of prostate cancer. So the first question is prostate cancer worth treating? Because there are a lot of side effects. Prostate cancer in some ways is very similar to breast cancer. They're both hormonally related cancers. With breast cancer, it's estrogen. With prostate cancer, it's testosterone. But the breasts are much more easy to access when you're operating on them. The prostate is buried in between very important structures. So one of those structures are the external and internal sphincters. And so by removing or radiating the prostate, you're potentially affecting urination. In addition, there are nerves that run just on the outside of the prostate. So if this is the prostate, the nerves run just right along here on both sides. And they're really, the nerves are the size of human hair.
Oh, wow.
And they're plastered right on the capsule of the prostate. And so if you're having prostate cancer surgery, robotic prostatectomy, you really need to find a very excellent, very experienced surgeon who's done hundreds and hundreds of these operations. Because in order to skillfully be able to remove the nerves without transecting them, you have to have a lot of experience.
That's the nerve sparing prostatectomy.
Exactly. Exactly. And so the reason that it's important is that the nerves run alongside of the prostate. So in the body, everything needs to be told what to do, right? Like most men need to be told what to do.
No, they know.
Okay. And so the nerves in the body are what tell structures what to do. And so the nerves are running alongside the prostate, and then those nerves keep going to the penis.
Yeah. Oh, right. So
are,
you lose all the nerve sensation.
Exactly.
You can't feel your penis anymore.
Exactly.
And does it work anymore if the nerves get messed up?
It tends not to be the sensory nerves. It tends to be those parasympathetic nerves that stimulate blood flow into the penis. And so that's the key.
That's why.
So these nerves come from the lower lumbar and sacral nerve roots, and they come out from the spinal cord. And then they go into what's called the pelvic plexus. And the pelvic plexus is this whole mishmash of nerves that live in the sacrum, in the pelvis. And then they shoot out alongside the prostate on both sides. Okay. And then they go out to the penis. And so in the process of removing the prostate, if you damage or transect or burn the nerves, you lose that parasympathetic inflow to the penis. And so you aren't able to naturally get an erection. So think about it like a lamp. Basically, you're cutting the lamp. So even if you keep changing the light bulb, you're not going to get the electricity that you need to turn the light bulb on. And unfortunately, once you cut those nerves, there's nothing you can do. Now, there's a capsule that surrounds the prostate. And when these nerves and blood vessels, because it's called the neurovascular bundle, so it's nerves and blood vessels, as those nerves and blood vessels run alongside the prostate, there are little holes in the capsule where the nerves and blood vessels come into the prostate, right? So just like you have a wall and you have a door. So this is the door where the nerves and the blood vessels enter the prostate. But if you're a prostate cancer and you're growing and you're pushing up from the inside against the capsule, what's the easiest place? What's the path of least resistance?
Through that door.
Is going through the door. Exactly. And so you get what's called perineural invasion. So if anyone has talked to a friend or they have prostate cancer themselves and they hear perineural invasion, peri means next to, neural is nerve, invasion. So it's prostate cancer that's invading the space next to the nerve. And so if you have a bulky cancer on one side of the prostate, or you have an aggressive form of cancer, you don't want to spare the nerves on that side, because in the end, you're going to leave prostate cancer there. And the whole point of the operation isn't to spare your nerves or make you continent, it's to cure the cancer. So that's sort of the danger. That's why you have either one-sided or both-sided or no-sided nerve sparing.
So a lot of the post-prostate surgical procedures that you do, you also in the remediation use GAINSWave to help men get back more function. Can you talk about what the most common function losses are and what kinds of things, including GAINSWave and other things that you do to bring function back for many men?
Exactly. So the two most common procedures for treating prostate cancer are either radiation therapy or radical prostatectomy. And so like we just talked about, when you remove prostate cancer, you potentially damage some of those nerves. And because you damage some of those nerves, you compromise the blood supply, because those nerves are the ones that are telling the body to pump blood into the penis. And so you want to make the blood delivery as efficient as possible. On the flip side, with radiation, you're not necessarily traumatizing the nerves, but radiation causes stenosis or narrowing of blood vessels.
Okay.
Okay, that's where GAINSWave comes in.
Okay.
That's the beauty of GAINSWave. What GAINSWave does is it causes new blood vessels to grow. So by using GAINSWave, which are basically shock waves that come from a device like this.
Got so many goodies down there
Oh,
on the
yeah.
table.
See, it went from that to that already. So basically, you apply these shock waves along the penis. And as you apply it to the penis, what is happening is the shock waves are stimulating the release of vascular growth factors and are stimulating stem cells and are stimulating the release of nitric oxide. Remember, nitric oxide is the neurotransmitter that nerves use to communicate with blood vessels. And you can boost nitric oxide by taking a supplement like Affirm. So Affirm is a nitric oxide boosting supplement. You take 2 tablets twice a day, because as you get older, you lose nitric oxide. And when you lose nitric oxide, basically you lose circulation. So a supplement like Affirm will improve circulation to the brain. So it reduces your risk of Alzheimer's, reduces your risk of dementia. A lot of elite endurance athletes will take something like Affirm as a nitric oxide booster.
Yeah.
So that's critically
it's a performance molecule.
Exactly. And so it's really critically important in any situation to take a nitric oxide booster to improve that. In addition, that's how
I would also say feed them to your wife.
Absolutely.
Because she needs as much blood flow as you do. So if you're taking something like Affirm, if you're taking any nitric oxide precursors, boom, 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 feed them to her too. She needs all that blood flow too.
Absolutely.
It's a his and hers.
And then GAINSWave. And there's actually a woman's version of GAINSWave.
FemiWave.
FemiWave.
Yeah.
But for men who've undergone either radiation or radical prostatectomy, by shocking both the deep cavernosal artery, but also going down the perineum and shocking the internal pudendal arteries, you're improving blood flow to the penis. And improved blood flow basically makes everything work better.
How do you get to the pudendal arteries?
Basically, you lift up the scrotum.
You're going through the perineal area.
Exactly, right through the perineal area.
Great. So that's where that is. So if someone has any one of these, what prostate issues can GAINSWave help with, and what doesn't it have an effect on? So if a guy was like, I don't know, is this going to be for me? What are the ones where it could really help him?
Right. So GAINSWave helps with vasculogenic erectile dysfunction. So if there's a compromise of nerves, then GAINSWave is not going to improve the situation. So in a non-nerve sparing radical prostatectomy, it's not going to work. Or if you have someone with severe multiple sclerosis or a stroke, or say type 1 diabetes for 20 or 30 years with severe neuropathy, it's not even worth trying GAINSWave. In that situation, you would go to maybe something like this.
Penis implant.
Penile implant.
Penile implant.
And so this is really good. Like, for example, if you're 50 years old.
Can you hold it up higher?
Oh, yeah, sorry.
That's okay.
If you're 50 years old and you have prostate cancer and you have a radical prostatectomy that's non-nerve sparing, and you want to be sexually active for the next 20 years, this is a fantastic solution. So all of this would be internal to the body.
Yeah.
Okay. This sits up next to the bladder. This pump goes in the scrotum, and these 2 cylinders.
Where's the pump?
Right there. Can you pump it up?
Yeah.
Just
yeah.
there
That's what's in the scrotum.
There you go.
You ready?
Yep.
Am I doing it?
Keep going.
Okay.
Gotta pump hard.
Pump hard. Oh, there I go.
There you
okay,
go.
Now I feel it. Oh, look at that. Oh, yeah, it's got a squirts right up. And those go down the corpus cavernosum, down each side.
Yep.
Okay.
So it actually doesn't go into the glands. So that
it just goes right to
the glands gets a little sort of floppy on the top.
Okay.
But that just goes with the territory.
Yep.
Now, when you're all done.
I wonder if you could use the vacuum erection device head enlarger on the glands to do anything to help it.
That's
you might be able to.
Yeah. So when you want it to go away, just squeeze that.
And zoop. It goes down. How much does something like this cost?
This actually costs $12,500.
That's nothing. I mean, in the grand scheme of things,
Yeah.
that's over the cost of 10 or 15 years of
And,
lovemaking.
the beautiful thing
Totally
is,
worth it. I'm surprised it's not more. That's pretty amazing.
that's what actually device costs, and then the surgery on top of that.
Oh, okay.
You know,
So how much is that usually?
they pay the surgeon $10, $15.
$10, $15. That's what you get. Yeah, pays for gas money.
Yeah, exactly.
We have
go buy a sandwich.
we have a couple of questions I want to take that are specific to GAINSWave. And I want to let you know that during this webinar, we have a GAINSWave special offer. And when you go to gainswave.com and you find a provider and you fill out the form, when you fill out the form, it offers you the ability to type in a special code, and the special code, you use the code BETTER, BETTER, and you buy 6 treatments and you get the 7th for free. So it's a bonus treatment, because GAINSWave is a series of treatments over time that allow your erectile function to regain the tissue, the nerve, and the blood vessel. It regrows them. It stimulates new growth. So it's a remediation of the tissue. So we have a couple of, and I don't know if anybody on my webinar can pin a special offer of any kind, but go ahead and do that if you can, guys. It's in the chat. You just have to remember BETTER. That's what you have to remember when you sign up for the.
I want to get better.
Yeah, exactly.
But the important thing to remember about GAINSWave is you don't get better overnight.
Right.
It takes about 4 weeks for you to get better. So if you're on your second treatment currently and you're saying, I'm not better, I'm not getting better, just wait. It takes about 4 or 5 weeks to grow new blood vessels. Remember, that's what is happening. You're stimulating vascular growth factors, you're stimulating stem cells.
Yeah.
And
you got to give your body a chance. It's using your body's own healing factors. You have to give your body a chance to do the work.
And speaking of using your body's own healing factors, you can actually use platelets.
Yeah.
So, and that's sort of the end cap of this whole thing is after GAINSWave therapy, where you're stimulating stem cells and growing new blood vessels. If you want to accelerate that growth, what you can do is use platelets. So platelets are amazing little cells, and everyone knows that platelets cause clot. But what most people don't know is that platelets carry over 140 identified growth factors. And so if you ever wondered why when you cut yourself, that area of skin grows back a lot faster than the rest of the skin, it's because platelets hone to that particular area, because when you cut yourself, your body releases these things called inflammatory cytokines at the location of where the injury occurred. So it's like if someone robs a bank, they pull the alarm in the bank and the police know exactly where to go. The same way there are inflammatory cytokines so that platelets know exactly where to go, and then platelets release these growth factors and it causes the growth of that tissue. So if you stimulated stem cells and you begin to grow blood vessels, if you add PRP to the mix, then all of a sudden you accelerate the growth.
And that comes from your own blood. So the platelets come from inside you. It's your own healing factors from your own body that are put back into your penis.
Absolutely. And if you remember from my last webinar, I've been doing PRP for my hair. And all of
I was saying to Judd, it's looking really good.
Yeah, these aren't hair plugs or hair transplants.
You're regrowing your own hair.
I just injected PRP right here because I'm always my own avatar. I've done shockwave on myself. I've done P shots on myself. I've done PRP for the hair. Yeah. You have to practice what you preach.
You do.
And I know you do that
I've
too.
had FemiWave, I've had O shots, I've had RF devices, CO2 lasers. I use photobiomodulation. I know we're like
the his and her of sexual biohacking.
We are, exactly. But it works. Yeah. That's what we're saying. All right. We have a whole bunch of questions about the stuff we've just been talking about. Absolutely. We haven't even gotten into the questions that were sent in yet, but we are here for you. This is what we're doing. So, okay. So I'm just going to start with the first one, which was, does GAINSWave, I saw that one and it was like, and back to the Peyronie's question. Martin wants to know. And Russell says, hi, Dr. Brandeis from Russell. So you must know him. Peyronie's. We've talked about this in our last webinar, but let's go over it again. So Peyronie's.
Okay. So Peyronie's is
curvature.
A
kink.
There you go.
A kink in your junk.
Yeah, exactly. There's Peyronie's right there. And in a lot of men, you can actually feel a plaque
Mm-hmm.
You know, it'll feel like a dime or a nickel or a quarter, or even I have a patient who's got about a silver dollar, and it depends on how long they're there. They can get calcified over time.
Mm-hmm.
And it's the conventional treatments are horrible.
Yeah, don't do them.
It's surgery, and basically surgery will shorten the penis the other way to make it straight, or using what's called Xiaflex. Okay, Xiaflex is a collagenase. It's an enzyme that's basically a flesh-eating enzyme that breaks up the peptide bonds between the fibers of collagen. The problem with collagenase is that, one, it's $4,000 per shot, and most patients need 4 to 10 shots. It reduces the curvature about 15 degrees. So you'll go from here to about there. And then third of all, you have a lifetime risk of penile fracture.
Mm-hmm.
And fourth of all, for a month after a Xiaflex shot, you can't have any sex. That kind of defeats the whole purpose.
Yeah.
Right.
But this is so much less invasive. So
Exactly.
you do a
So I
shockwave.
developed a protocol.
Pump out too.
Yeah, yeah.
Where did that go?
Oh gosh.
It was in a little box. One of our team
Oh no,
will
it's right
find
here.
it. Oh, it's right
There you
there.
go.
Okay, let me
All
drag
right.
that out because I
So,
know you're going to want to have
yeah.
that next. Keep going.
And so what we do with the GAINSWave is we treat the area of the scar tissue. We treat it with a narrower probe with much more intense shockwave. In addition, we do the regular erectile dysfunction shockwave. So you have improved erections. Improved erections will cause stretching of the tissue. But then on top of that, let me use this bad boy.
Let me get it for, oh yeah, let me get that out for you. I'll get it for you. That's the one you prefer.
Yeah.
Yeah, sorry about that. I
No
forgot.
worries.
Oh, does it go this way?
Yeah. There you go.
Okay, good. I hadn't put this one together before.
Okay, yeah, that's good.
Is that good enough?
Perfect. Yeah.
Okay, great.
And so basically what you do is you put the penis pump over the penis, and then you create a vacuum.
It would
And
be
that-
getting larger
Yeah, there you
if
go.
that
So
was a real
I'll do it
penis.
in.
Oh, there you go. So hold it up a little bit.
There you go. Okay, so you get it to the point where it's stretched in there, and then you stretch it a little bit more, and then you hold it for a minute. Kind of like yoga, right?
Yeah.
And then once you have a full stretch, you push this little red button, and that deflates it. And then you do it again.
Good.
Okay. And then you hold it in there, and it stretches it out. And what that's doing is it's stretching the scar tissue.
Mm-hmm.
Now, you don't want to do it if you haven't done GAINSWave on the penile plaque, because what happens then is you're overstretching the normal tissue, but you're not stretching the penile plaque. And so you actually are going to make the problem even worse. What you need to do is something, either collagenase or GAINSWave, preferably GAINSWave, to break up that scar tissue, to break up the collagen, and then stretch things out. And you know, it works on all kinds of penises and all colors of penises.
Oh, you have to show everybody that penis.
Exactly.
Judd has a bottle opener that has a penis on it. Where'd you get that? Like
one of
Bali or
my
something?
favorite patients brought this back from Bali. My patients bring me the most bizarre gifts.
I need to get one like that. I really need a bottle opener like that. I'm very jealous of your bottle opener. All right. So, guys, can you scroll me to some more of the questions? I saw them earlier and I don't see them now. I don't read. There was one where, gosh, I wish I could see it. Yeah. Tim's going to come over and scroll it for me.
Do you want to talk about that patient that had the injury?
Yeah. Okay. So Faisal, he had an injury where he had an erection while he was sleeping, and he was in a group of men, and a man kicked his penis and basically caved in the side of his penis. And he went to the doctor, and the doctor said, you have penile arterial insufficiency. And let me tell you about that one. Let's see.
So, you know,
Reduction in sensitivity.
what that means is that there are two corpora, or two tubes. Actually, let me get
it got broken down. So it wasn't Peyronie's, but it was an injury to the corpora.
Boy.
Oh, great. Let me move out of the way for you.
Story time.
Oh, good. Girls and boys, we're going to tell you some stories about penises and prostates.
Okay.
That's a good one.
There we go.
Let me take that side for you.
There we go. Okay.
How's that?
Excellent.
Good.
Okay, so this is a cross section of the penis, and you can see this little red dot on either side, that's the deep cavernosal artery. This is the corpora. Corpora means body. Cavernosa is deep. So the deep penile bodies, and you have deep cavernosal arteries. And maybe this poor gentleman, when he got kicked, it disrupted that blood flow in the deep cavernosal artery. And so the question is, okay,
got it, okay.
That artery is damaged.
Take that for you.
That's the main arterial blood flow to that side of the penis. What can you do?
So it was artery damage.
Artery damage.
Okay, so what can he do?
So GAINSWave will actually help develop collateral circulation.
Oh.
Right. So if you think about it, like if 101 is
jam-packed, take 405.
Yeah, you're taking other freeways. And
okay.
So what this is forcing your body to
do. I was
so
worried about him. Freeways. That was such a crappy experience for him. So GAINSWave can help him.
GAINSWave can help him. And also PRP.
And PRP,
so on a
right.
Like
give it a turbo booster.
Exactly. In a patient like that, what I would recommend is a nitric oxide booster like Affirm. I would have them go PDE5 inhibitor. And the beautiful thing is Cialis and Viagra, they're all generic now. So in my office, we sell them for $1 a pill. So $1 a day, it's less than Starbucks coffee.
And what does that do?
Okay, so what that does is...
Because you know me, I don't like to take pills.
Right. So those medications were actually developed as heart drugs.
Yeah.
So a lot of people say, oh, it's bad for your heart or it's bad for this. They were developed as heart drugs, and what they are vasodilators. They open up blood vessels, and they do it using your body's own natural enzymatic systems. And so when your nerves are stimulated, they release nitric oxide. Nitric oxide then stimulates a cascade of events. And that cascade of events can't go on forever. So there's an enzyme called PDE5. And PDE5 is specifically in the penis. That's the brilliance of Viagra, is they blocked a specific enzyme that's only in the penis. You have PDEs all throughout your body.
And there's a whole bunch of them. There's PDE 1 and 2 and 3.
And so if you specifically block PDE5, it specifically affects the penis.
Okay.
And so what it does is it prevents the breakdown products of this cascade initiated by nitric oxide. And so nitric oxide and a PDE5 inhibitor work really well together. They're synergistic. It's not like you can do one or the other. You could do one or the other, but they work better together. Kind of like peanut butter and jelly.
Because the nitric oxide is actually increasing your ability to move the blood through the circulatory system. And then the PDE5 inhibitor is what's allowing that blood to stay in there for a while. Is that what it is? Is it kind of like slowing down the combustion engine so it doesn't burn it up so fast, if you will? Okay. All right. So they're synergistic. Now, is there plan for GAINSWave to regenerate damaged prostate tissues?
It doesn't regenerate damaged prostate tissue.
Okay.
I don't know that you necessarily would want to do that.
Okay.
But the amazing thing, and we're actually beginning to do studies on this, is chronic pelvic pain.
Do men have a lot of that?
Men do.
Women have also a lot of it.
And it works. So there have been a few abstracts, not a lot of big studies, but I've done probably half a dozen in my office.
Okay.
Just for free, just to see if it actually works.
Yeah.
And it actually works really well for chronic pelvic pain.
Wow.
So people come in and they get these trigger point injections where you take a long, thin needle and inject either steroids or lidocaine or both into the internal pudendal nerve.
Yeah.
You can do exactly the same thing with shockwave.
Wow.
Without a long needle.
Wow.
Yeah.
How do you get it in there? Where do you go?
Basically, just right along the perineum.
Right. Because that perineum is that's the
information
superhighway. It
It
is. I love that. And really nice to have it massaged too.
There you go.
Yeah. All right. We've got some more. Let's see. Is Affirm okay for women that have had estrogen sensitive breast cancer?
Absolutely. Affirm is a nutritional supplement.
Great.
So it's watermelon rind, which has L-citrulline, it's ginseng, it's beets, and it's potency wood. And what that does is it non-specifically increases blood flow by increasing nitric oxide. And so it's great for men, it's great for women, it's great for elephants, it's great for squirrels, it's great for giraffes. Any mammal uses nitric oxide.
Yeah, well, if it's good for squirrels, it's good for me.
Give it to your pet giraffe.
I have a good question for you. This is from Tom. I had my prostate removed via open radical prostatectomy in 2004. Because of resulting incontinence and failing other alternatives, I had a bulbourethral sling implanted in 2006. It's functioned perfectly ever since. I'm currently 73 years old and considering GAINSWave therapy for ED. I have had success with PDE5 and injection therapy. My principal hesitancy about proceeding with GAINSWave is my concern that it does not impact functioning of my sling. Can you provide any guidance in this regard? That's such a good question.
Yeah, that is a fantastic.
Tom, beautifully worded too. Thank you.
So as long as your PSA is undetectable, I think this would be an extremely efficacious and safe procedure.
Oh.
And it should not affect these are polypropylene mesh slings. Polypropylene is a very strong plastic.
Mm-hmm.
And basically what happens is the tissue grows into that sling, almost like a lattice that you're putting in the garden, and then the vine grows in.
Yeah.
And so at this point, the sling is totally incorporated in the tissue, and there's really almost nothing that you could do to hurt that sling.
Great.
I think it would be a great option.
Here's an easy one. This is a softball for you, but you're doing great. Will GAINSWave help with venous leakage?
Wow.
I told you it was a softball. Although we want to make hard balls around here. Let's just say it's a hard ball.
So what you really want to do is increase the pressure on the inside of the penis, because as that pressure increases, so the interesting thing about the penis, and you know everything about the penis, but
I'm always learning about the penis.
For those folks out there who don't quite know as much about the penis is the only organ in the body with skin but no muscle. And it's the only organ in the body that moves entirely based on blood flow alone. And so it's critically important to pump blood at high pressure into the penis. And that's not so easy to do, because if you think about it, when your heart pumps, the first place blood goes to is the heart, and then the brain, and then the lungs, and then the liver, and then the kidneys, and then the intestines, and then it splits into right and left, and then it goes to the leg, and then it goes to what's called the internal iliac artery. And the internal iliac artery feeds the buttock muscle, it feeds the tailbone, it feeds the bladder, it feeds the rectum, it feeds the vas deferens, it feeds the sacrum, and then after all of that,
it feeds the penis.
Exactly. So the thing that's most on guys' mind is the last thing that gets blood.
The end of the line, guys.
And what you have to do is you have to get the blood pressure up to at least 100, 150 in order to
150 what?
Millimeters of mercury.
Millimeters of mercury.
Right. So when you take your blood pressure, it's 120 over 80, you got to get the blood pressure high enough that it begins to obstruct or block the venous outflow. And so that's sort of part of what a venous leak in a lot of people is you're not getting a rigid enough erection to block the outflow.
Right. You have to get it filled up so it goes and locks it off.
Exactly.
And so the endothelial smooth muscle tissue, smooth muscle cells? What are they?
Right. They're smooth muscle tissue and cells.
Tissue and cells.
They're what they're called sinusoids.
Sinusoids.
If you look at the inside of the penis, it looks like a sponge.
Yeah.
And you're filling up those spaces. So when the parasympathetic nerve stimulation occurs, you open up blood vessels, but you're also opening up those chambers in the spongy tissue that allows the blood to fill. It's almost like when you're breathing, you're expanding your chest and you're allowing the air to passively go into that based on pressure. When you open up those sinusoids, blood's rushing.
That makes sense. All right, we've got a couple more. Let's see. Stephen says, you said as long as PSA is undetectable. Why? I don't remember when you said that. Do you know what he's talking about?
The issue is, okay, if you're not cured of prostate cancer and you have residual prostate cancer from either surgery or radiation growing in the prostate fossa, this is something that creates new blood vessels. And so the last thing you want to do to a growing cancer is to create new blood vessels. Does that make sense?
Yes, it does.
Yeah. So I wouldn't do it if, there's no data either way. There's not a huge body of data on treating post-prostatectomy patients with a PSA recurrence, doing shockwave therapy and following those patients. But just intuitively, based on what I know about all this stuff, which is kind of a lot,
yes,
I wouldn't take a chance.
Okay.
Yeah.
All right, I've got a long one here. This is from David. He says, and we've got more questions. If you've just joined the webinar and you didn't hear that we have a special offer for GAINSWave, and that GAINSWave can be very helpful in recovering from a lot of prostate issues. The special offer is that you buy 6 treatments and get the 7th treatment free. You go to gainswave.com/directory and you can find a GAINSWave provider in your area. And when you fill out the form to request a consultation, there's a little comment box, a little code box, and you put in the code BETTER, like you want to feel better. That was good, Judd. BETTER, and you'll get the 7th for free if you do decide that GAINSWave is the right thing for you. So David says,
okay, can I take this one? Because it's kind of a complicated
one.
Yeah,
did you read it?
You
can just short.
When you were talking,
good,
I kind of read it.
Perfect. Yeah,
right,
do
so
that.
This,
good.
David,
Great.
unfortunately, had ductal prostate cancer, which is a more highly aggressive prostate cancer. He had a TURP, which is a resection of the prostate, and went through 2 chemotherapy treatments, which mean he had a fairly aggressive prostate cancer, had 52 radiation therapy treatments, which is usually radiation's about 40 treatments. So you must have had a pretty aggressive treatment. You were on Xtandi and Trelstar. So these are medications that basically knock down your hormonal levels. And something like Xtandi it's about $100,000 a year.
Wow.
Which is a very expensive. It works on the nuclear receptors of testosterone. And right now you can't get an erection and you have a dry orgasm. So you have a dry orgasm because you've had radiation therapy for the prostate, and that prostate's kind of totally shrunk down, and you're on a testosterone blocker. So you're not making any testosterone. So the fact that you're actually even interested in having any sort of physical intimacy is fantastic. Why do I have to continue with the hormones after radiation therapy? Well, it seems like you have a fairly aggressive prostate cancer, and there's survival data showing that a combination of radiation therapy and hormonal therapy will give you a survival advantage. If you want to get off of the hormonal therapy, that's really the only way that you'll know that the radiation has actually succeeded. I don't blame you, but I would talk to your medical oncologist or your urologist about that. You have a very complicated case, and it's sort of beyond my ability to kind of play TV doctor.
Yeah, exactly. Yeah, without all the information, we can't answer
all
the
Gleason
questions.
score was 9, right? So that's a very aggressive prostate cancer.
Yeah. All right.
Advanced localized cancer. So I would, just based on the limited amount of information that you have, I would certainly recommend staying on combination hormonal therapy.
Scroll up for one more here. Yeah, I've had long-term chronic pain in my pelvic floor, 27 years, aches in the perineal area. PSA is fine. I've had a Urolift. Did we kind of answer this one already? We kind of talked about the Urolift and the pain. It's painful. It is painful to urinate and ejaculation stings. I don't know where to go for help. My local urologist is of no help. Who can help? So his PSA is fine. It hurts in his perineum. It hurts to urinate and ejaculate.
Right. It seems like
that's misery. I'm so sorry, Ron.
Okay. So you likely have prostatitis.
Prostatitis, which we didn't really talk about.
We didn't really talk about it.
We kind of got right into the cancers, and we didn't talk about the infectious issues.
So the prostate is a very difficult place to cure an infection. Okay, for a couple of reasons. One, the prostate makes semen, right? And semen is basically fructose, sugar.
Yeah, sugar.
What do bacteria like to grow in?
Sugar.
Okay. The other thing is, in a sugary, watery environment, it's very difficult for your white blood cells to actually swim out to get to the bacteria. It's kind of like, I tell patients, it's kind of like Afghanistan, right? As soon as the American army goes after the Taliban go back up into the caves, right? And it's hard for our army to go up into the caves and take out the Taliban. So as soon as the army leaves, what happens? The Taliban come back out of the cave.
Yeah.
And so you take antibiotics for a month. As soon as you're off antibiotics, a lot of patients, the bacteria will start to replicate again. So they hide up into these little crypts in the top of the glands where it's really difficult. So really important in terms of treating prostatitis, take the long-term antibiotics, either 2 to 4 weeks of antibiotics, and take the entire course. If you take a short course, it's kind of like, remember those old Halloween movies where they would like kill Freddie, and Freddie would be sitting in the corner and everyone would be celebrating.
Come back to
and
life.
then they come back to
I
like finish the
hated those
job.
movies.
And
I
Freddie's
can't watch
gone.
those. It's
You know, and
scary.
it's Friday the 13th part 72.
Yeah.
Right? The same thing with prostatitis. Prostatitis is like Halloween movies. If you don't nail it the first time, if you don't fully complete the course of antibiotics, if you don't ejaculate frequently, because that's the only way to get rid of the infected semen, then it's gonna come back.
Oh, that's interesting.
And it can become chronic, and people can get it over and over and over again. Now,
yeah.
there are situations where people get chronic pelvic pain. So you've eliminated the active infection, but you have this kind of chronic discomfort, and that's a different situation. Those are the patients that need something like GAINSWave through the perineum to help treat their chronic pelvic pain.
Yeah, Ron says he's done tons of antibiotics. A lot of people are on them. And then you've got to really watch out for your gut microbiome, because what happens then is with all those antibiotics that you're taking, you're killing all the good bacteria in your gut. So you've got to be taking the good probiotics and eating really high probiotic and prebiotic foods all the time. Your nutrition becomes so important, because as soon as your gut's not working, you're not manufacturing your neurotransmitters like serotonin and dopamine. So you're starting to get depressed, and then you're not manufacturing your hormones, because they don't just get made in your testicles. Your gut and your brain are all involved in this. So
absolutely,
you really have to take
Ken
care.
is asking a good question.
Okay, good.
Which is, will I have to use Viagra after having GAINSWave treatment? Good. And so it really depends.
Okay.
It depends where you start. So if you're 75 years old and Viagra is not working for you anymore, it's not going to make you 20 years old. Yeah. Okay. So I go through a series of kind of typical patients. Okay. So a typical patient that I'll see in my office is 55 years old. He's been using Viagra, but he doesn't want to take Viagra anymore. I mean, it's humiliating to guys to have to take a pill in order to be physically intimate with their spouse. I'm sure you've heard that.
Of course.
I mean, tell me what you've heard.
Yeah, of course. I mean, for a lot of men, they feel like it's an insurance policy, but they don't like having to do it, and they wish they didn't have to do it. I know that for a lot of men, they feel like they're really letting their partner down because they're having erectile dysfunction. They never know if it's going to work or it's not going to work, even sometimes with Viagra. And, you know, a lot of women take it personally, even though they know better. Women say, well, maybe you're not attracted to me anymore. Maybe I don't do it for you anymore, or what have you. And so I know it does create a lot of stress, and then that creates performance anxiety. And then you have trouble with erectile function. It just like kind of feeds on itself, and you get into this kind of downward spiral.
Exactly. And so part of what we do in the office is give men confidence that they can, so that the spiral starts to reverse and go upward. But a 55-year-old man who's doing well on Viagra, we can get to the point where he doesn't need Viagra anymore. Great. So then we see a lot of men who are 65 where Viagra was fine. They got it from their primary care doc. They got it from, you know, Mexico or Canada or wherever. And all of a sudden it's not working anymore. Yeah. Okay. What we can do for this man with GAINSWave is get him back to the point where Viagra is working. Good. Okay. I don't think that we'll be able to ever get him to the point where he doesn't need Viagra anymore, but it's working. Now, there are other things we can do. We can do PRP. We can do PT141. We can do
a nitric oxide.
Exactly. That's a peptide. We can use a nitric oxide booster like a Firm. So there are a number of things that we can do. We can use a vacuum erection device. There are a number of things that we can do to kind of augment the effects of GAINSWave. But for the most part, what I'll tell this patient is it's likely that Viagra will work for you, but it's unlikely we'll be able to ever get you off Viagra. Okay. If we do, it's a bonus. Yeah. Okay. All right. Well, and then the other patient, exactly. Then the other type of patient I have is a 75-year-old man where Viagra doesn't work anymore at all. Okay. And what I tell that patient is, you're certainly going to need GAINSWave, at least 12 treatments. We're going to need to do PRP. We're going to need to do a vacuum erection device. We're going to need a nitric oxide booster like a Firm. And we'll be able to get you to the point where you're going to be able to get an erection that's adequate for penetration, but you're not going to be performing like you were 20 years ago. We can turn the clock back 5 or 10 years. And for a lot of those guys, that's what they need. Sure. The other thing is really important is lubrication in this age group. Both from a male standpoint and from a female standpoint. You know, if your erection isn't fully rigid enough, it's really important to have good lubrication. And if your partner is postmenopausal it's really important to have good lubrication, because if your spouse isn't enjoying it because it feels like sandpaper, you're one and done.
Yeah.
Right?
If you're lucky.
If you're lucky.
If you're lucky, one and done. And as far as healthy lubrication, what I like is organic coconut oil, organic avocado oil. You have to get the kind of avocado oil that's not green. It needs to be a little filtered. Those organic nut oils are healthy. You could eat them. Anything that you can eat, that's good. If you wouldn't eat it, don't use it on your wife, because her vaginal mucosa is a sponge. It really soaks up whatever is put in there. So the good news is it soaks up your sperm, which is full of luteinizing hormones and zinc and serotonin and testosterone and all kinds of things that are great for her. So that's very symbiotic. But what you don't want to do is use KY jelly or any of those kind of junky things you get at the drugstore. Just get a nice organic coconut or avocado oil and use as much of that as you want. And what's nice is you can go back and forth from oral to intercourse, because you just wipe it up and it's tasteless, or it tastes good like coconut oil. So I really highly recommend you get that. So we've got a few more.
Well, there are a couple more questions up on the screen.
After you've had one 6 or 7.
Yeah. So one was, where can you purchase Affirm? So you can go to affirmscience.com on the internet and order Affirm. In addition, there's another supplement that we sell called Prelong. And Prelong is the only supplement out there for premature ejaculation. It's all natural. So it's L-citrulline and St. John's wort. And St. John's wort works almost like a selective serotonin reuptake inhibitor, but it's not a pharmaceutical produced antidepressant. It's a natural
botanical
SSRI. Exactly. It's a botanical.
Yeah, very good. Well, premature ejaculation affects 1 in 4 men. There are at least 25% of all lovers wish they could last longer. So, and because it's botanical, and I like citrulline more than arginine, because anybody that has herpes is affected by arginine. So having the citrulline is, to me, a higher quality product anyway. So that's a good combination, brilliant combination. Okay.
I'm 72 and I use Trimix injections. Will GAINSWave replace injections, or will I keep using injections? And that's another fantastic question.
Yeah, really good one.
I've had several patients who use a Trimix injection. Trimix injections. There you go. All right. So for men, especially, this is very effective for diabetics and for men who've had non-nerve sparing prostatectomies. What you do is you aspirate vasoactive substances. So chemicals or medications that cause blood vessels to dilate, which is sort of like what Viagra does and what nitric oxide boosters do, but instead you inject it directly into the penis, into one of the corpora cavernosa. And the corpora cavernosa communicate with each other, so you don't have to inject in both sides.
Oh, that's interesting.
All you have to do is inject it in one side, and the entire penis gets erect after 5 or 10 minutes.
And then how long does the Trimix erection typically last?
It depends on how good the vasculature is, and it depends on the dose.
Would GAINSWave help with the vasculature if the Trimix was starting to fail?
Exactly.
So you could do GAINSWave even if you're taking Trimix to increase the efficacy of it.
Absolutely. So I've had a number of patients who have been using Trimix, and they get to the point where they don't need the Trimix anymore.
Ooh.
Now, I can't get them off Viagra, so they'll take high doses of PD5 inhibitors like Viagra, but they'll get off the Trimix. The question is, do you want to stick a needle into your penis every single time you want to make love?
Yeah.
And for someone like a diabetic,
they get used to it. Yeah, you get used to it.
But it's still, you have to keep it refrigerated. And so logistically, it's really difficult. And if you're concerned in a confident sense about taking a pill, sticking a needle into your penis is going to make it even more difficult.
Yeah. All right, we've got more. You guys are doing such a good job asking questions. Don't you think we're getting such great questions?
Absolutely.
Thank you so much.
Well, this is a good one too that Gregory asked.
Yeah, go
ahead.
I had
radiation as one of my treatments for rectal cancer. Will GAINSWave be able to treat my ED? Fantastic question.
Good.
All right, Gregory. So there's the prostate. There's the rectum. And see those yellow things? Those are nerves. And so if you're treating, radiation for prostate cancer can be very precise because the prostate is a solid organ. meaning that it doesn't change shape. It doesn't really move around. But the rectum obviously can change shape dramatically. You know, if you have stool in the vault, if you have air in the vault, if you have some inflammation, that moves around a lot. And so when you radiate the rectum, you have to radiate with larger boundaries, with borders.
Bigger margins.
With the exactly. With the prostate, the margins with the current like CyberKnife radiation therapy is about 2 to 3 millimeters. So you radiate 2 to 3 millimeters around the margin or the capsule of the prostate. Whereas with rectal cancer, the margins have to be much wider because of the variability of where the rectum is. And so you can see there's something called Denonvier's fascia. So it's this fat plane right here between the prostate and the rectum. And that's where the nerves live.
Yeah.
And so if you're radiating the rectum, you're going to take out some of those nerves in Denonvier's fascia and cause erectile dysfunction. And GAINSWave would be an ideal treatment.
Yay!
Yeah. So
wow.
There you go, Gregory.
So how do you get to that perineum again, right?
Perineum right here.
Going
so look,
right up in there.
Exactly. So this is the perineum.
Yeah.
You're going basically right below I have to thank my wife, Anjali, for getting me all these models.
Yay, Anjali. she's here
fantastic.
with us too.
And, here we go. All right.
Perfect.
So I would take the shockwave device and go right here. And you can see how the shockwaves would go boom right here. And this is where those nerves are.
Yeah.
So when you do a nerve sparing prostatectomy, the nerves live right there.
Yeah.
And when you're doing shocking through the perineum, that's exactly where you want to go, right there. That's where the internal pudendal artery and those nerves that are the parasympathetic nerves, right there.
Okay. Next one is, do you want to take Don's question?
Sure, Don. My question is transrectal ultrasound prostate biopsy, 12 biopsies. So first of all, Don, you should never have a transrectal ultrasound prostate biopsy anymore. Everyone, the standard of care, and I started doing this 4 years ago, the standard of care is to get an MRI, a 3 Tesla multi-parametric MRI of the prostate. I cut down the number of prostate biopsies that I was doing in my practice by 50%.
Great.
Okay. A transrectal ultrasound prostate biopsy is not an innocuous procedure. About 2 to 3% of patients will get a severe infection. You can get severe bleeding. It's an uncomfortable procedure. And so get an MRI first before you consider doing a prostate biopsy. Okay. And then an MRI-guided prostate biopsy is much more accurate than a 12-core prostate biopsy. So when I was doing 12-core prostate biopsies before MRIs came out, my biopsy positivity rate was about 33%, and that's pretty standard across the country. After I started doing MRI-guided prostate biopsies, my biopsy positivity rate was 85%. I went from 33% to 85%. So anyone that's going to urologist that's doing a normal 12-core biopsy without getting an MRI first, I would recommend that you find another urologist.
Okay.
Okay, this is the standard of care now. Okay, so a transrectal ultrasound prostate biopsy is where you put the ultrasound probe through the rectum, and then using ultrasound, you can directly visualize the prostate. And then you take a long thin needle and take little pieces of tissue along this back part of the prostate.
Okay.
Okay.
And that's to check for cancer.
That's to check for cancer.
Okay.
Absolutely. Okay. So
the MRI just helps you aim right.
Exactly.
Okay.
Well, first of all, you can see prostate cancer with the MRI. So if there's no prostate cancer, why do the biopsy?
Oh, well, there you go.
And then if there is prostate cancer, that's why it went from 33% to 85%. Because first of all, I eliminated 50% of the patients who I would have biopsied that didn't have prostate cancer.
Yeah, right.
Okay. And then the ones that I was doing, the other 50, I was able to aim much more accurately at the prostate. It's like shooting archery, not knowing where the target is.
Yeah. Great.
You're not going to do very good.
How you doing? You want a glass of water?
I'm doing great.
Take a sip.
Perfect.
So the question is, if he's had that, is it truss or truss?
Truss. Transrectal.
If he's had the truss biopsies and they were all negative, how long does he need to heal before he can go get his GAINSWaves and use promo code BETTER?
I would say a month.
Oh, okay.
Yeah,
so that's
a month
not
would
bad.
Be fine. And you'll have blood in the semen for about a month anyway. Yeah, sorry.
Terrible. Sorry about that.
I know that's what you want to avoid it if you can. Get an MRI.
Did we answer Stephen's question? Data on the efficacy of GAINSWave for post-nerve sparing prostatectomy and post-radiation therapy?
So Stephen, yeah.
Did we answer that?
We did not answer that, but it's a fantastic question. So Stephen, first of all, at Brandeis MD and through a generous grant from Affirm Science, makers of Affirm and Prelong, we have secured funding for what's called the SWEET study, which is the Shockwave Erectile Enhancement Trial. And we're recruiting patients through 42 GAINSWave providers. And our goal is to get 3,000 patients. What can you do with 3,000 patients? First of all, 3,000.
That's a big study.
That's a big study.
Most studies have 100. Most studies have 20 to 25 people in them.
Exactly.
So that's a very large study.
So the meta-analyses, which means if you take a study of a bunch of studies with shockwave therapy, is around 600 to 800 patients. So our study, when we complete it, should have more patients than all of the other shockwave studies combined. And so what you can do with the data from 3,000 patients using a number of different machines and using a number of different protocols, it's an observational study. We're not telling the doctors do it this way. We're just having patients report data from when they have that treatment. What we're going to be able to do is begin to form treatment recommendations so that you'll be able to go to our artificial intelligence neural network model, type in, okay, I'm 52, I have a SHIM score, which is a score estimating your erectile function of, say, 15. I'm a smoker, I'm on beta blockers, and put all that information out, and we'll kick out recommendations to you. You know, we'll recommend 12 GAINSWave treatments with a P-shot, with a nitric oxide booster, so on and so forth.
If it were me and I were a guy, I would just do all that stuff anyway. I would get the GAINSWave, I would have the nitric oxide, I would get the P-shot, I would use the penis pump, I would just do everything because it's all additive. None of it's contraindicated. It's all synergistic. It all works together. It all helps get you firmer. And I still can't get over that thing you taught me in the last webinar where you explained that the man, as he ages, his penis atrophies. So you guys get shrinkage. And as we women age, our vaginas shrink, but that gives us vaginal laxity. So our vaginas get bigger. So your penis gets smaller, our vagina gets bigger. So that's one of the things that I love about all this sexual regenerative technology is that I can go in and get an RF device inside my vagina, and a Femi lift, which really makes the clitoral structure nice. You can go get GAINSWaves. I can get an O shot. You can get a P shot, and you can keep your genitals in good working order because, you know, the average age of the guys on this webinar is probably 65 or 70. I mean, it's probably 60. I would say the average
age or their chronological.
Their chronologic age, definitely. You can reverse your biologic age.
I mean, so I give this lecture called Biohacking the Aging Penis. And what that means is that there are biohacks. What a biohack is something that you can do to kind of short circuit or keep the system. So for example, Viagra is one of the greatest biohacks ever invented, right? It's going to take someone who is sexually 60 years old and now make them sexually 40 years old. And so there's a bunch of interesting physiology papers that talk about men physically achieve their peak in their 20s. And for every decade after
I don't believe that. I think maybe, all right, you said physically, yes, but I think sexually men don't peak until their 60s or 70s. That's what I think. I mean, I think people get better and better sexually over time. And that 60, 70, 80, and even 90-year-olds are having the best sex, not 20 and 30-year-olds, because they don't know what they're doing. So biologically, yes. Right, biologically.
And, you know, my expertise basically is increasing blood flow to the penis.
Yeah.
That's sort of
your thing.
Your expertise is
passionate lovemaking.
Yeah, exactly. Other parts of physical intimacy.
Yeah.
Right. So the physical part, and then there's the intimacy part.
Yeah.
And so most of my practice, I mean, I talk to my patients about the intimacy part also, but my focus much more is the physical part about increasing the blood flow.
Yeah.
And so in a physical sense, men peak in their 20s, and for every decade after that, they'll decline physically about 10%. And so the question is there something that we can do to decrease that 10%? And so men go to the gym, men exercise, men compete. And so you can reduce that decline by about 5% per decade. So is there something that we can do sexually to increase the blood flow to the penis so you're not declining 10% or more every decade? And these are these biohacks for the aging penis. First of all, boosting testosterone levels. Second of all, boosting nitric oxide levels with Affirm. Third of all, taking a PDE5 inhibitor. Now that tadalafil or Cialis once a day is $1 a pill, I mean, why wouldn't you take it? And then GAINSWave is the ideal biohack for the aging penis. And then a vacuum erection device. And these are the beautiful thing about these things is none of them really have any side effects.
Ken asked, did you say not to have platelet treatment when you have an enlarged prostate?
No.
No, you can have it.
Yeah, unless you're injecting the platelets directly in the prostate. And I certainly wouldn't recommend that.
No, so you can have the PRP or the platelet-rich plasma or platelet treatment or P shot or Priapus shot. Those are the same words, are different words for the same thing, even if you have an enlarged prostate.
Exactly.
But you should deal with your enlarged prostate as well. All right, so let's see. Is any or all of this covered by insurance? That's an impossible question to answer, Ron, because everybody's insurance is totally different. So you have to check with your insurance provider. But generally, a lot of these biohacking treatments are not covered by insurance. So, and where do you find out more about the SWEET study? How do you sign up for that?
Sure. You can actually go onto GAINSWave.com. And look, there's a special designation around the SWEET study providers. There are 42 SWEET study providers all around the United States. All of the GAINSWave providers are trained to perform GAINSWave, but the SWEET study providers are the ones that tend to have a higher volume in their practice and are participating in the study.
Milton wants to know if any of this works for a micropenis.
Micropenis. So a micropenis is a penis that's basically 2 standard deviations below normal. And so it's typically a penis that's less than about 3 inches.
Okay.
But micropenis has the same blood supply as the normal penis. And so I don't see any reason why it wouldn't work for micropenis.
Plus, you can use a vacuum erection device, aka penis pump, to do penis enlargement, adding the PRP, and it's just going to accelerate the enlargement and the gains you get from pumping regularly.
Exactly.
And so will the GAINSWave treatments. They will help you with increased penile volume. So it really works with a micropenis. You're starting out with overall less material, but you're gaining the same amount of gains that any other penis is gaining. So you're going to have exactly the same results as anyone else, which is great.
So Cliff asks an interesting question. So he had recently had penile plication surgery to correct severe Peyronie's disease. So penile plication surgery basically means your penis is turned up, and when it's turned up, right, the top part is shorter.
Yeah.
Right. So what we mean by shorter is that most guys talk about penile length as with an erect penis. So the penis is fully stretched. And so when it's turned up, it's because this side is shorter. So the easiest thing to do is just basically take the skin down and then do what's called a plication, which is where you make the bottom side shorter.
So then it's straight, but it shrunk your penis. You said that earlier.
Exactly. So what I would recommend to Cliff is if you're having any degree of erectile dysfunction, get GAINSWave. In addition, after you do the GAINSWave, use a penile stretching device.
Oh yeah, right? You want to use a traction device.
Exactly.
Did you bring one?
I
can't believe you didn't bring one.
I think it's in that blue bag right over there.
Oh great. We'll show it to you.
Yep. So you can certainly use a device like this, which also is a penile stretching device. Oh, here we go. There you go. Now it's stretching.
Our classy simulations.
I think it's in the blue. Is it in the blue bag?
I don't see it.
Well, if we find it, we'll show it to you. But you like those? It's like a hanger kind of thing. Oh, there it is.
There you go.
Perfect. Oh, well done.
Tim saves the day once
Yay,
again.
Tim's
all right.
the best.
This is a RestoreX penile traction device. It's developed by folks associated with the Mayo Clinic. And so what you do is you put the penis in here, and there are all these little handy dandy adjustments that, okay, so that makes it shorter.
You want me to hold it? Do you need any help?
Let's see.
You're good.
Okay. And then
hold it up a little higher for the camera.
trying to figure out how to quickly open up these jaws.
Can I hold this for you?
Sure.
I don't like that they're called jaws.
Yeah.
Let's call them soft
So
mouths.
basically what you would do is you would put the penis
inside
in
that
holder,
little thing. Okay.
right? And then over time,
Mm-hmm.
you can increase the length.
Okay.
And then with Peyronie's disease, you can actually pivot this.
Turn it down.
So you can put extra pressure
On the part that
on
you're
the part.
decrimping.
So, and you can flip it around. So if you want to decrimp this way
Mm-hmm.
or decrimp that way.
Uh-huh.
And so this is a penile. There are a couple of penile traction devices. The one that I like is the Restore X.
Okay.
I like the design and the way it works.
Huh. And how long do you wear that? Like 20 minutes a day?
15 minutes.
15 minutes?
Well, 15 minutes straight. And then for Peyronie's disease, 15 minutes
Against
putting pressure on the curvature.
Mm-hmm. Yeah. Okay. And does that increase, that just increases length, or what do you use that for?
Well,
What's traction for?
So traction in some patients, you can use it to increase length.
Mm-hmm.
And also it works really well for Peyronie's disease to put a specific traction on a particular area.
Gotcha. After you've done the GAINSWave, you can
Especially
wear
after
the traction
GAINSWave.
device, and then that's what's going to hold it so that it kind of grows back into the larger, longer shape.
Exactly.
Okay, that makes sense. Question from David. For a patient who was treated with for prostate cancer, are you saying that GAINSWave is not advisable?
I'm saying for most patients treated for prostate cancer, it's a great option.
There you go.
If you have residual prostate cancer in the prostate fossa, it may not be such a good option. Or if you've had a non-nerve sparing prostatectomy where the nerves are cut, it's probably not a good option.
And it's not a good option because if the nerves are cut, you're not going to be able to get an erection no matter what you do.
Exactly.
And in that particular case, could you have a penile implant?
Absolutely.
So the non-nerve sparing prostatectomy is your penile implant option.
Exactly.
Okay.
Or you can use a vacuum device.
Vacuum erection device with a constriction ring, aka penis pump with a cock ring.
So this is the constriction ring. And it goes right around the base of the penis. And this is the cutout for the urethra. And these are from Gesiva Medical, Gesiva Medical at gesiva.com. And so these are really nice silicone rings, which is why I mentioned the name. Mm-hmm. And so this is the cutout for the urethra.
Yeah, that goes on the bottom.
That goes on the bottom. And this is what holds the blood in place by blocking the venous outflow.
So there you can pump up, bring the blood into your penis, roll this down on top of it, and then it traps the blood in, and they say about a half hour, right?
You don't want to leave it on for more than half an hour.
Yeah, half hour's long enough, but that should give you a nice firm erection.
Absolutely.
For penetrative intercourse.
Absolutely.
Yay for penetrative intercourse. I like it. All right. He's Ken. Hey, Ken. I know you. I'm when people write their last names and I'm like, I know them. Ken 76. Will it hurt to try GAINSWave? No, it will help to try GAINSWave, Ken.
I've had patients as old as 83 get a lot of benefit from GAINSWave.
You betcha.
Because the thing is, chronologic age and physiologic age are two different things. I had one patient on his 80th birthday. He did 110 push-ups in 1 hour.
Nice.
Yeah. Mr.
That's
Pappas.
amazing.
He was amazing. Yeah. And he broke Jack LaLanne's record. So, physiologically, he was 40, 45.
Nice.
But chronologically, he was 85.
Don wants to know if you've heard anything about the Giddy device.
Giddy device. I don't.
I
learned so much from my patients.
Yeah.
And so, Don, what I'm going to do is I'm going to go home and I'm going to look at what the Giddy device is.
Email it to me, Don, and I'll forward it to Dr. Brandeis. All right. I think we can finally get to some of the questions that we got earlier. And this one is one I've been wanting to hear your answer to.
Oh, but there was someone that's sorry.
Oh, wait.
Cut you off. Jeff is asking about Vibrect device.
Oh, okay. I missed that one.
So there are male vibrators.
Oh, yeah.
And this is, so I had a patient, he came in with his wife who was exhausted and he was having difficulty ejaculating and it would take him 3 hours.
That's what I wanted to talk about with delayed ejaculation.
It took him 3 hours to ejaculate, and I recommended the Vibrect, or there's another one that I think that you talk about.
Yeah, the hot octopus.
Yeah, that looks even better.
Yeah.
And it reduced it from 3 hours to about 20, 25 minutes. Mm-hmm. And that when they came back in the next time, the wife was so happy.
I bet. Yeah, it can be very exhausting for a woman to be with a man who has delayed ejaculation, especially if she's older and all that friction is painful for her. So here's a question from a gentleman who has had a reduction in sensitivity and difficulty reaching ejaculation during intercourse. He's had some ED over the past few years. He's used some PDE5 inhibitors most of the time. He uses a lot of different high quality herbs. His testosterone is in good shape and good for his age. He started, at my suggestion, thank you, GAINSWave in February, and he's had treatment number 12 because he's not doing them monthly.
Mm-hmm.
He also had a P shot in February. He's always had a high libido. He's liked sex every day. His wife, luckily, is easily able to achieve penetration orgasms, but his biggest issue is that he's having he used to be able to ejaculate a year ago. He used to be able to ejaculate 90% of the time. In recent months, far lower. He's not feeling sensitivity, and he can't seem to achieve ejaculation. So, but he said that one of the things he notices is they have sex at different places around the house. And if they have sex outside, it's easier for him to achieve ejaculation. And that gave him the clue that the novelty of having sex outside might be something in the dopamine issue. There might be a dopamine connection to the novelty helping him have the ejaculatory experience. So what would you say to this gentleman?
So this may be someone that you might want to boost serotonin.
Boost serotonin.
Yeah. So something like Prelong, which boosts serotonin, improves ejaculation. There's something about.
But wait a minute, Prelong's for premature ejaculation.
But it's the increase of serotonin improves ejaculatory function.
Interesting.
Yeah.
So the thing that's made to keep you from ejaculating too fast can also help you ejaculate?
It helps with ejaculation in general.
Oh, that's interesting. Yeah. So is it like adaptogenic where it kind of goes where it needs to go?
Pretty much.
That's interesting.
Yeah.
St. John's wort.
St. John's wort.
Okay, so you think it's serotonin levels, not dopamine.
Yeah, ejaculation is a very difficult thing to study.
Yeah.
Because
everybody's so different.
Everyone's so different.
Circumstances change.
And it's such a sort of fleeting event.
Yeah.
You know, it's not, and it's hard to get two people to have sex in a MRI machine or so on and so forth. And so especially something like premature ejaculation is very difficult to study. But what they found was that patients who were taking selective serotonin reuptake inhibitors, all of a sudden, a lot of their premature ejaculation problems would go away. And so that's where they begin to get the clue that serotonin has something important to do with ejaculation.
I'll be darned. So he was on the right track with that dopamine. He was just on the wrong neurotransmitter.
Exactly.
Fascinating. All right. Here's another gentleman who's 79. He's enjoyed an excellent sex life with a loving and caring wife. I love hearing that. 12 years ago, he had his prostate out, as well as penile nerve and vas deferens at the same time, because they thought it all might be cancerous. Following that, he had ED and he used injections to overcome them. He's always had excellent libido, but 6 months ago, his libido fell away and his penile sensitivity. So he's tried penis pills, testosterone, and various sex tools, the last of which was the Hot Octopus Solo, which was the one we were just talking about. But no difference. Porn didn't help either. He didn't like it. Good for him. So nothing's made a difference in his libido. Do you have any ideas? He says, should I accept it and retire and age gracefully? I'm like, no way.
Yeah. I mean,
this is not the place where you age gracefully, not with us. You go out fighting till the end. Things can be done.
GAINSWave. Bring in the shock.
That was my maiden name. Isn't that funny? All right. So what do you do when you're losing sensitivity and you're losing libido? What
testosterone.
Happens? More?
Yeah,
just
more testosterone.
Jack it up.
Just jack it up.
Okay.
You know, you can get to the point
with
testosterone that you're going to improve your libido.
Okay.
I think it's just, you know, if you bring your testosterone over 1,000, over 1,200, you're going to be climbing up the trees. There's no question about it.
Well, that was one of the best answers I got from the whole thing. All right. Well, that was easy. Testosterone it is. Next one. I was fixed about 12 years ago. I noticed very soon that my ejaculation fluid was much less. My sex life's been active this past 12 years, but it seems the fluid is very low. Could this be corrected with prostate massage? Plus, my fluid is very clear the majority of the time.
So a vasectomy basically stops the flow of sperm. but ejaculation is 99% from the prostate. So a vasectomy really has nothing to do with ejaculatory volume. What you probably have is a blockage of the ducts from the seminal vesicle, which is reducing your ejaculatory volume. So actually something like prostate massage may actually be beneficial.
Great.
Yeah.
Oh my gosh.
Yeah.
That's so cool. I love doing this with you. This is so amazing.
So someone's asking a great question, which is, how long does it take for GAINSWave to work?
Oh, okay.
And
perfect.
that's important because it's really important to remember 4 to 5 weeks. If you're 2 weeks in or 3 weeks in and it's not working, don't worry.
Yeah.
Right. Because the anxiety that you're going to generate worrying about it, first of all, is unwarranted.
Yeah.
And second of all, those stress hormones that you're going to produce are going to work against the production of an erection that you're trying to achieve. So just forget about things for about 4 or 5 weeks. And then after 4 or 5 weeks, get your spouse some flowers, get a nice bottle of wine, go on a vacation, do something romantic, and it'll flow. It'll happen for you.
Well, and plus there are men who've told me that they needed to have not just 6, they needed to have 12, or they needed to have 18 treatments. And there are some people for whom 18 treatments was the trick. They were like, I just kept going and I got my full function back. So,
absolutely.
like you said, it just depends on where you're starting. Where are you now and where do you want to get?
Yep. There's a great study out of Greece that showed 12 treatments in 6 weeks, followed by 6 more treatments 6 months later.
It totally makes sense. Give your body time to do the work you created, that you stimulated it to heal, let it heal, and then see how you do.
And the thing is, we're naturally impatient people, right?
No.
So, these things have been declining over a period of 5 or 10 or 15 years. And then
or 20 or 30 or
20,
40.
Yeah, exactly. And then people expect you to come in with this and this
just like,
and make me better in like a couple of days. I'm sorry, but that's just not the way things work.
Just thank God there's GAINSWave. What dose? Ken wants to know what dose of Viagra is safe to take at a time.
You can take
his wife. My wife wants to know.
You can take
Ken's wife.
You can take up to 150 milligrams. After about 150 milligrams, the dose response plateaus out.
Is it true that increased testosterone is not good for enlarged prostate?
That is true. So if you have an enlarged prostate or if you have prostate cancer, it's not safe to take extra exogenous testosterone.
Good. Okay. The next question.
That's Ryan asking,
great.
Have you seen GAINSWave PRP work in type 2 diabetics with Peyronie's and ED? Wow. Ooh. That's a compound question.
That is a lot.
So I have seen GAINSWave work great in type 2 diabetics.
Yep.
And I've seen GAINSWave work great with Peyronie's disease. Yep. And diabetics have a 3-fold risk for having Peyronie's disease. And you might ask why. Yeah.
I'm asking why.
Okay, so if you have diabetes, your penis is not as rigid. And so it's more likely to buckle during intercourse because it's not as rigid.
And it's the buckling during intercourse that damages
the
tunica albuginea. We're dick nerds.
Yeah.
We're over an hour into this. We're an hour and a half in with you guys. We can say a few funny things now. Okay, so then your answer to Ryan is, look, it works with diabetics, it works with Peyronie's, it works with gay, it works with ED, so why not try it, man?
Exactly.
Yeah. Okay.
No, it'll work great for you. It really will.
Yay.
And, it's restorative.
Yeah.
So for all the men out there that are taking Viagra and thinking that it's the answer, well, it's temporarily the answer, but Viagra doesn't do anything to the physiology permanently. What GAINSWave does is it grows new pipes.
Yeah.
This is curative. This is going to turn the clock back 5 or 10 years for you so that Viagra is going to work for another 5, 10 years. So what you don't want to do is take Viagra till it doesn't work and then try something new. What you want to do is do GAINSWave, and then when GAINSWave's not working, then you have Viagra.
I like it. Well, we've got some people who've just come on. Hi, Danielle. She wants to know how GAINSWave works again. But just before you answer that, can you do the David one? ADT therapy seriously lowers a man's testosterone, that one?
Right. So this is more of a prostate cancer specific question. ADT stands for androgen. Androgen's like testosterone. deprivation therapy. So prostate cancer is a testosterone sensitive disease. And if you eliminate testosterone through medically castrating a man, you basically, it's kind of sad. You lose testosterone. What does testosterone do? It gives guys muscle mass. It gives you aggressiveness. It helps your mood, all that kind of stuff. And
makes
so
you never ask for directions when you're lost.
Yes. Makes you pee on the toilet seat. So, I mean, there are pros and cons of everything in life, right? And so it definitely will lower muscle mass. And so
sarcopenia.
Exactly.
That's what that's called.
When you reduce, when you're on androgen deprivation therapy, it's really important to eat well, to exercise as best you can, to do things that stimulate your brain, because testosterone is really important for men. And so it's very likely that men will put on weight. It's very likely they'll put on muscle mass. It's very likely that they'll cognitively decline.
They'll lose muscle mass.
Exactly.
Yeah. Okay. All right. Danielle said she just joined. Welcome. We got a lady in the house.
Wow.
That's very nice. Thank you so much for caring about your men. And I think we should also talk just briefly about the FemiLift, since Danielle's here, and she just wants to have you show her how GAINSWave works again.
Sure. So just in terms of women, the ladies' parts and the women's parts and the men's part basically form from the same embryological tissue. They just go in different directions. So the women, the clitoris, the bulb of the clitoris is basically the same as the head of the penis. The legs of the clitoris that go down the labia are the same as the two corpora cavernosa. And so, and then the actual labia are the same as the sides of the scrotum. And then the testicles
and they
are the
look
same.
Like it. The more you age, especially. That's what's nice to get them lifted. A little vaginal rejuvenation there, a little RF to the labia.
And so using shockwave therapy, one to the penis, but also to the clitoris and the crura of the clitoris as they go along the labia, will improve blood flow.
Yeah.
And by improving blood flow, you improve erectile function or sexual function in women.
Yeah, you improve your orgasmic function because you get return of sensitivity. And so you have it's more easy to have more orgasms, which is nice.
And so, Danielle, if you want more details, you can go to GAINSWave.com, or you can go to Brandeis, BRANDEISMD.com. And I also have educational videos on shockwave therapy, on GAINSWave for Peyronie's disease. And so either GAINSWave.com or BrandeisMD.com are great places to learn about these.
You want to show the shockwave on the penis, just how you do it?
Sure. So basically you shock along the shaft of the penis, not on the head because the head has a different blood supply, but along the shaft of the penis on both sides, and also below the testicle along the perineum, because when you go from the perineum, you get the nerves and the blood vessels coming up behind the prostate, the internal pudendal arteries and nerves.
All right. And that's about 6 treatments to start, depending on your health and where you are from an erectile function perspective. It could take twice that. For some people who've been very, very ill for a very long time, they've had to take 3 sets of treatment to get their erectile function back. You can combine that with PRP and with vacuum erection devices, with nitric oxide, with PDE5 inhibitors, and have that full complement of synergistic effect to reverse erectile dysfunction. Does Viagra stop working due to developing a resistance to it?
You don't develop, it's actually a really interesting question.
It's a good question.
So you don't develop a resistance to Viagra, but what happens is as you get older, you lose nitric oxide.
So you've got to combine it with the nitric oxide.
So it's really important. Viagra will work better when you combine it with a nitric oxide booster like a Firm. So Viagra prevents the reuptake of the byproducts of nitric oxide. And so if you have less nitric oxide, you have less to prevent the reuptake of. And so by boosting nitric oxide, it'll potentiate or improve the effects of Viagra.
Huh, that's amazing. Here's another one about a Firm, which is the nitric oxide product that Dr. Brandeis made. If you have an enlarged prostate and a minimum level of prostate cancer, can you take a Firm?
Yeah, you can, absolutely. It naturally boosts circulation. So when you take something like a Firm, it decreases your blood pressure about 4 or 5 points naturally. In addition, it will improve circulation of the brain. So it reduces your risk of Alzheimer's, reduces your risk of dementia. A lot of elite endurance athletes will take nitric oxide boosters. So it non-specifically increases circulation.
How do you biohack your semen volume so that you shoot giant, enormous, ropey loads of semen? That was the question that I got.
You know, I don't know. I can't know everything. I can't know everything.
He says that he has been taking amino acids, zinc, Tongkat Ali. It's been helping, but it hasn't really gotten him where he wants to go. All right.
Yeah, sorry.
That's okay. Yeah, this is the
It's
same.
important to say when you don't actually know something.
Heavens, yes.
I could make up something.
I'm 70 plus and suffering from enlarged prostate and ED. What's the best remedy for seniors for hard erections? Say it one more time.
GAINSWave.
There you go.
Well, but you know, so for my 70-year-old patients, like I said, I'll certainly put them on a nitric oxide booster. I'll start them on a PDE5 inhibitor like generic Cialis once a day. GAINSWave, typically 12 treatments for someone in their 70s, and really important, a vacuum erection device. And let me, there it is. Okay, let me show you why it's so important. Okay, there are things that happen as you get older, and most importantly, you don't get nighttime erections. So when you're younger, 3 to 6 times at night, you'll get an erection for 5 or 10 minutes. That means 30 to 60 minutes of penile exercise every single night. When you get older, you don't get that exercise anymore. So for example, if you didn't stretch your hamstring for a year, do you think you could walk? Of course not. But if you didn't stretch your penis for a year, what happens? So first of all, the tunica albuginea is really this tough
membrane
tissue.
almost.
Right. So it's 2 millimeters in width, which doesn't sound like a lot, but your aorta, the biggest blood vessel on your body, is only 1 millimeter. And so it's very difficult to stretch out the tunica albuginea. And so this penile pump will then begin to stretch out the penis. And so a lot of men, when they hit their 60s or 70s, will say that they're losing the length of their erection. And the reason that they lose the length of their erection is they're not stretching that tissue. Now, the other thing is the inside of the penis is this spongy tissue. But if that spongy tissue isn't getting oxygenated blood, it becomes fibrotic. And what I mean by fibrotic is if you take a sponge and you put it out in the sun for a couple of days, it gets that kind of flat pancaked appearance. Sponges work by having space. And so when blood flows into that sponge, if it's compressed down, it's going to be really difficult for it to expand in girth. And third of all, think about blowing up a balloon, right? If you blow up a balloon, the first time you blow up a balloon, it's really rigid and it's hard to blow up that balloon. Well, if you blow up a balloon 20 times, then all of a sudden it becomes easy. And so the vacuum erection device can do a number of things. It can stretch the penis back to its original length. It can improve blood flow into that spongy tissue so it accommodates that blood more, and it can make it much easier for that stretching of the penis. Because remember, even though sex is the first thing on most guys' mind, it's the last thing that gets blood. And the ability to pump blood under pressure into the penis is really critically important. You want to do, as you get older, you want to do whatever you can to help that situation.
That was a great explanation.
Well, thank you.
Yeah, thank you. You're doing an awesome job.
Oh, so
everybody's still on. It's amazing. We've got a couple more questions. How's your energy?
It's great. But one other thing that I want to say is, so a lot of guys try to have physical intimacy at 11 o'clock after a big meal.
Yeah.
And a couple of glasses of wine. So if you're the club tennis champion and you want to play for the club championship, what are you going to do? Are you going to wait till play your match till 11 o'clock at night after a big meal with some steak and French fries and have a couple glasses of wine to get out onto the court? Of course not. Yeah. So as you get older, you have to think about, okay, this is blood flow. Yeah. And what can I do to maximize blood flow? You don't want to have a big meal because all the blood's going to go to the intestines. You don't want to have a lot of alcohol because it's going to get you dehydrated. You don't want to be tired because you're not going to perform physically in an optimal way. And so, but what happens to guys is they get to the plate and they swing and they miss the first time and they start to doubt themselves. And then they swing and they miss the second time And by the time the third time they get up there, they produce all these stress hormones thinking, I'm not going to, things aren't going to go well for me. I'm going to swing and miss the next time. And you know what happens? Yeah. It's a self-fulfilling prophecy. So as you get older, you have to be more mindful of your physical condition.
Morning sex.
Exactly.
Or afternoon delights. I like those too. Yeah, I get too tired at night. All right. We've got a question here about testicles, and Martin and Ron both want to know what the cause and results of testicles lifting up out of the scrotum above the shaft are. What's that?
Martin, you got to be a little bit more specific.
Okay, be more specific. Or Ron, if you think you know.
The lifting up and down of testicles is from the cremasteric muscle. So in the abdomen, you have your abdominis rectus, which are the sit muscles, and then you have 3 layers called the obliques. Mm-hmm. So you have the transversalis and then the internal and external oblique. And the external oblique then goes down through what's called the inguinal ring, which is where you get hernias. And they attach to what are called the cremasteric muscles, which attach to the testicle. And they serve an important function, which is to lift your testicles up and down, depending on the temperature, because sperm production takes best place at around 97 degrees and your body's 98.6. So if you go into cold ocean water, you get significant shrinkage, right? Your penis pulls back and your testicles pull up because the testicles want to be close to body temperature. Mm-hmm. And if you're in a hot sauna, like Tim's probably going to take after this podcast, your testicles are going to be down by your knees because they're going to be like, whoa, it's too hot here. Let's get far away from the body.
Yeah. Okay. Well, there you go. That makes sense.
You like that image, huh?
Progressive desensitization. Does it happen because of too much porn? I've started looking at different forms of porn because it seems like I get bored from seeing the same things over and over again. Do you advise watching porn or to stop it?
I know very little about porn and the porn industry.
Yeah.
You might be able to handle that better than I can.
Well, I would say if you are feeling a desensitization and watching more and more hardcore porn, you should stop cold turkey. It literally is like going through a withdrawal from nicotine or any other addictive habit. So that's definitely what's happening, is that you're getting on a dopamine swirl that you are just you're running out of your dopamine.
Right. It's the same thing as young girls looking at 17 or Cosmo magazine and thinking, I want to be as beautiful as that. When I lived in Los Angeles, we would see a lot of these models and actresses, and in real life, they look like normal human beings. And so to watch movies, to see sort of this idealized, supercharged people do. And in fact, I've seen several patients who show up in the emergency room from getting injection therapy in the penis to keep an erection for a long time.
Uh-huh.
And so, people are using pharmacology to create these ridiculous super erections, and they end up in the emergency room getting me called in at 2:00 in the morning to inject phenylephrine and other things to pull blood out of the penis. So I'm not a big fan of porn.
Yeah, nor am I. Degrading to women for the most part. Better to use fantasy. It takes me longer and longer to finish. I've been doing some research, and I believe this is a result of being circumcised. Everything I read suggests that sex is better for the man and woman if the man is not circumcised. Circumcision seems to have been implemented in the U.S. to destroy men's sex drives and sex lives. Do you have any idea if I can restore my foreskin? And do you think that the circumcision is the result of my delayed ejaculation?
Millions and millions and millions of people around the world are circumcised. Yeah. And I think very few people complain about that.
Yeah.
I'm not really I don't think this is the right place to get into the argument over circumcision versus no circumcision.
Right, because it's a kind of a religious
it's a religious
practice
issue.
Yeah.
I think people get way, way too hung up on the foreskin. As far as I know, there's no way to restore the foreskin.
Mm-hmm.
Someone
I know
talked
there's
to
those
me.
Hangers.
Yeah, someone talked to me the other day. They wanted a circumcision, but they wanted the skin at the base of the penis removed. And that doesn't sound like a bad idea to me. So if you want to have an adult circumcision and you're able to withdraw the foreskin pretty easily, and you wanted to sort of keep that sensitivity on the tip of the penis, maybe remove a collar of skin at the base of the penis.
Wow, never thought about that. More than one way to skin a cat
exactly.
or something. All right.
You would have a strange incision around the base of the penis, but if you didn't mind that, it wouldn't be a bad thing.
Huh. It's amazing all the different things you can do to a penis. All right. I think this is the last question. His testicles have disappeared.
Disappeared.
I just wonder if that's testosterone.
It could be testosterone.
He thinks he might have a hernia.
Yeah, you could have a hernia. I mean, hernia is really super easy to check for. Just go to your primary care physician.
Mm-hmm.
Other people have a large penis, so a large fat pad
Mm-hmm.
that hangs over their penis. So a lot of people think penis. Yeah.
Oh, that's like on the mons of the woman. It's the same type of thing.
Yeah, it's that kind of extra roll of fat that sits below the belly button.
P-A-N-U-S?
Yeah.
Huh. What about it?
If it gets too big, then it hides the penis.
Uh-huh.
A lot of people come in and complain like, oh, my penis is like a turtle.
Uh-huh.
Sucks in there.
Yeah, turtling. Exactly. Yeah. All right. Well, I think we have answered every question. You guys wore us out.
I need a cigarette.
I know, right? Ooh, it's hot in here. And we've been going for almost 2 hours.
Wow.
So thank you
That's the
all.
longest I've gone in a long time.
Thank you all so much for the stamina you brought to the webinar. Thank you, Dr. Brandeis.
We're supercharged on GAINSWave. That's why we got 2 hours.
And I hope, and thank you for all the gains. Thank you to all the GAINSWave team as well. You helped us produce this and put it on and get everything working. Thank you to Tim Bratton for getting all the tech working. Thanks to Anjali Brandeis for carrying, remembering, feeding us, watering us, taking care of us, and all those things. And especially thanks to you for showing up and being here for so long with us. If you have any nice comments, that is what fuels us. We are here to support you. And I really just want to give Judd, I want to give you a hand, a round of applause. He did an amazing job, didn't he? Isn't he wonderful?
What a pleasure to work with you. Really, you're absolutely amazing.
We enjoy each other. That's
and,
for sure.
And the code word one more time was?
Better.
Better.
Yes.
Get better.
GAINSWave. And by the way, get that code in now while you're thinking of it, because if you don't get it in, it expires. So you don't have to use it right away, but you got to get it in right away. So that's the most important thing. Go to gainswave.com/directory and fill out the form for the GAINSWave provider in your area, and then write in the code BETTER, B-E-T-T-E-R, and then that will get you the 7th GAINSWave for free with your series of 6. So there you go. Thanks to everyone. Have a wonderful evening, and God bless, and all the best, great sex, and bomber hard-ons for all. Take care.